Hello, good afternoon. This is Dr. Do again. This video is still on alphabetic list of problems on letter F. Today I'm going to talk about the fibrosis and the fibroma. Probably I'll break into like we did before. Is any associated conditions, fibrosis or fibroma, need to visit emergency? Pretty much not, because these are the chronic conditions, unless the fibrosis is associated with, for example, pericarditis. The pericarditis late stage and the fibrosis is so severe that the two layers of the pericardium attach each other together and limit the heart function, or the pleuritis, which is the two layers of pleural membrane around the lung, get fibrosis getting very serious, fibrotic, and pain associated with breathing, and also the pericarditis at later stage of fibrosis causing the pain with breathing and heartbeat has to be changed position to accommodate. If that's the case, limit the heart function, limit the breathing. So if that's the case, probably associated with the emergency. Other than that, fibrosis is a chronic stage, it's a recurring stage. Usually it's not associated with the emergency. Can you manage at home? Fibrosis? Yeah, if you put that way, probably you can. Actually, I don't know whether I can put that way. For example, a scar. On the skin, that's the process of fibrosis, but I'm sure you can just watch and but usually when we talk about the fibrosis, it's a process that's the normal tissue replaced by the fibrotic tissue. So regardless of that, we call it scar, we do not call it fibrosis. So need to be managed by the physician. Usually the fibrosis is the recurring stage. So what is the fibrosis? How did that happen? So fibrosis, I'll just start from the inflammation. Inflammation, I've mentioned before, is a process that body defense mechanism through raising the local temperature because of the defense cells like a macrophage or other kind of neutrophils, for example. If there's an injury or there's a bacteria local, for example, use the skin. If there's a injury or there's a bacteria or infection, like little pimple, and then the process usually is the blood start to increase at local level, and also the space between the endothelial cells of blood vessels start to enlarge. So then the neutrophils or the macrophage start to come out from the blood to defend from the infection. So then during this process, also some local fibrotic cells, fibroblast cells to come at the site to lay down some fibers to heal it, to stop bleeding, to heal the tissue, to connect the tissue together to recover. So that is the process for the fibrosis. So usually the fibrosis should be a process which is positive, which is good, to stop bleeding, to heal the skin, for example. But sometimes there's some, and the skin has the great potential to regenerate. So the scar usually, unless it's very deep, penetrating the basal layer, which is the bottom layer of the skin, that is the stem cell located. So that if it's not injured into that level, usually no scars, because it can regenerate the normal skin cells. So the same idea applies to the internal organ after the ischemic, or for example the liver fibrosis, or after the heart is undergoing ischemic attack and then healed with fibrotic process. So sometimes, like I said, if it is in the skin, fibrotic is a good process to heal the wound, to facilitate with the recovery. The same idea inside of the organs. However, if the fibrosis is severe, like I said, if the pericarditis or pleuritis. I talk about the 2 layers of connective tissue around the lung, or 2 layers of connective tissue around the heart. Usually there is some fluid in between these 2 layers to lubricate when the breathing, the lung expanded or becomes smaller, or the heart dilate or contract. So these are the subtle space which provide the flexibility to buffering the mechanical force, and also the fluid in between to lubricate, also to provide nutrition. If the inflammation, for example pericarditis or pleuritis, undergoing the same process as the skin, so a lot of inflammation cells at the local area lay down the fibrotic tissue, becomes the fibrosis. So if that's the case, that's not good, because if you imagine 2 layers of the pleural or the pericardium connected together, there's no space, there's no lubrication, only the rubbery or feel the friction and rubbing against each other, either during the breathing or during the heart contract or dilate. So if that's the case, that is no good, has to be treated. What kind of medication can, the same idea apply to the lung organ or the liver or the kidney. So what kind of medication can slow down or can melt down this fibrosis process? Anti-inflammatory, steroid is one of them. So that's why if the pericarditis late stage or inflammation cause the pericarditis, so that's one of the mechanisms treated with the steroid to promote healing, at the same time to decrease the chance of fibrosis. And there's a special condition associated with fibrosis, is also called the fibroma. It's just a cluster or like a nodule or a tumor, but it's formed by the fibers. Basically, it's the fibroblast cells lay down extra fibers, and usually they occurred under the skin. And this is the benign tumor. No pain, usually no pain, unless it's a fibroneuroma, which is the fibrosis around the nerves and forming a nodule or tumor. That is painful, because the sometimes majority could be benign, could be malignant, but the pain is there because the nerve cells is tangled with the fibers, was undergoing the irritation all the time. So that is the painful. Usually, if you feel your skin, you can feel something. Fibroma is kind of little, not soft, but it's not very hard, in between the cancer or the benign, and it's very mobile. It can move. There's if you touch your skin, there's some growth. First thing you touch, see whether it's movable or not movable, whether it's hard or it's soft. For example, the movable under skin nodule could be the fibrosis, a fibroma, or the lipoma, and you feel the texture or the sense of the tumor. If it is harder or it is soft. If it is soft, it is probably lipoma. If it's hard, but it's mobile, that's probably the fibroma. Now, both of these are the benign, but just for cosmetic reason, you can take them out, see the physician take them out to do the biopsy to make sure it is the fibroma. It won't hurt. You have it if it does not bother you, or for cosmetic reason you see a physician and take it out. It's a very small office procedure. Everybody can, not everybody, the dermatologist or the primary care or the surgeon can take them out, send the pathology, confirm it is a fibroma, which is benign, totally benign, no any malignant behavior. So that's the confirm. So basically, this since we're on letter F, I just talk about the fibrosis. You probably see it all the time. Your X-ray or your mammogram, there's a little fibrosis or calcification, such as, or the lung, little fibrosis. So you probably wonder, what is the fibrosis? I just give you some idea. Usually it is a healing process, but if it's organ like an important organ or the important location undergoing the fibrosis will limit either breathing or heart contraction, so that is not good. Usually fibrosis referring to the but if it's like fibrosis usually can occur in serious problem like interstitial lung disease. That's the process of the mesenchymal cells of the lung undergoing fibrosis, which is not good. I mentioned before, but just give you some idea what is the really fibrosis means, and just mention the fibroma, which is totally benign, but for cosmetic reason, probably it's good to take it out to see a physician to confirm the diagnosis. Okay, so I'm going to stop here. Thank you for watching. I will see you next time.